Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch presented by UMass Memorial Healthcare. This summer is a great time to travel, but it is also the midst of the 100 deadliest days for teen drivers.
On the highways, there's much more volume of traffic. The people that are driving are potentially less knowledgeable about where they are because they're on vacation. They're driving slower. Some are driving distracted, looking at maps and all the other kind of things that we find drivers today do. And the worry also is that there's a lot of partying going on, so some of these folks are impaired as well. So the combination is a very bad one for motor vehicle crashes, and that's why I think it's so important that we kind of get the word out. We've got to be serious about minimizing the risks. You know, you can't eliminate them all, but there are some very definite steps we can do to reduce the risk of injury or fatality behind the wheel.
Medical and transportation officials don't refer to them as accidents. They call them motor vehicle crashes because they are predictable events.
The accident is the kind of thing where you're walking down a street and something falls off of the roof and hits you. But motor vehicle crashes, as we call them now, or injury events, are very predictable because they almost always entail excessive speed, impaired driving, the kind of distracted driving that we see with texting and driving. We know that it's particularly in the two extremes of age groups, the very old and the very young, these are risk factors that make predictability of these events very, very high. Anything that is predictable is preventable in our mind.
When it comes to saving lives, the number one thing is seatbelts.
We have the 48th ranking position of all the states in the union for utilization of seatbelts. I mean, seatbelts is such a simple thing that will really take about 90% of the sting out of an injury event because they'll really prevent the head injury piece, which is the most hard to recover from. Here at the trauma center level, we're doing so much better with the expertise we have, with the kind of very experienced trauma team approach to these patients, that if we get here in that golden hour, and that's where our first responders are so great at getting those patients here so quickly, we have a very good shot at helping them survive. With a head injury, and sometimes even with just the psychological burden of having experienced a major trauma like that and having to go through a prolonged rehab, your sense of self, your sense of security, and your cognitive ability can be irreparably damaged, and that's a lot to come through. And especially in that frustrating way of saying, this was all preventable. If you hadn't texted and driven, if you had worn your seatbelt, if you weren't speeding.
Similar to when a pilot prepares for a flight, Dr. Hirsh recommends all drivers have a checklist.
We like to make the young drivers, and any driver, think about the same stuff. Do I know where I'm going? Do I have enough gas? Is my car in a good condition? Am I in a good condition? Do I know that it's not the right time to text and drive? Those are the kind of things I think if people just took a minute and be mindful of where they're going and what their purpose of the drive is, we can make a big impact in this.
From car seats to driving simulators, UMass Memorial embraces a cradle-to-college approach.
We have our child passenger safety inspection program that's staffed by child passenger safety technicians that we provide, and as well are provided by the state police and the Worcester police, so that every 2 weeks there's a setup in our local EMS garage where a young parent can come and get their car seat checked. You have to reposition the car seat age appropriately as the children grow. So the vehicle was obtained through a grant from the Allstate insurance company, and it is a real eye-opener for teens. It has 2 driving simulators in them that are really state-of-the-art kind of virtual education devices. And you sit in a very realistic driver's seat, and you have kind of 3 panels in front of you that gives you almost a 3D view of the road. and you're tasked with driving, and you start out driving, in the normal fashion, and you get a feel for the road. And with the young people's abilities these days to handle video games, this is a piece of cake. But then if you throw in different conditions, we can throw in bad weather conditions, we can throw in impairment, like either that you're buzzed from marijuana use or drunk from, and we can change the level of intoxication too. And then also we can have the person drive but be tasked with doing a text during the drive. I think the texting thing is mind-boggling because the kids never think about what it is to text and drive. So when they realize that they have taken their eyes just to make even like a 3 or 4 word text happen off the road for almost a football field and a half, that's just an enormous amount of land to cover, and who knows what was in that space. Young people, animals, other cars. So the great thing about the program that we have also is that it's not just the crash happens and, get a new life. It takes you through the whole process of police coming, questioning you, charging you with vehicular manslaughter sometimes if you've killed your friend, or certainly, more than a DUI. You sit in front of the judge in this vehicle. You even then, 10 years from then, apply for a job and they see that you have a felony on your record. I mean, I think it really hits the people that take this course right between the eyes that there's a consequence to these decisions.